Hello, everyone. I'm Solomay Tibabu, the host of Going Digital Behavioral Health Tech, and we have a great conversation today with Samantha and Tom. Welcome. How about before we get started, if we could do some brief introductions, name, title, organization. Let's go. Samantha and then Tom, please.
Hello, everybody. I'm Samantha. I'm Assistant Vice President of Strategy and Business Development for MultiCare's Behavioral Health Network. Happy to be here.
And this is Tsang. I'm the CEO, co-founder of Valera Health.
Thanks so much. So you've got a really exciting partnership between your two companies. Looking forward to learning more. Maybe Tom, if I could start with you, how did the partnership come to be?
So I flipped right instead of flipping left. No. I'm going to actually defer this question to Sam.
Yeah, I would say a little over a year ago, within the pandemic, we realized that we needed to improve our digital health presence, our digital front door, our reach. And unfortunately, with behavioral health, there's just no shortage of need everywhere across all acuities. And so we had work in inpatient to do, work in residential, work in our integrated health settings, work in our employees' mental health. And so really quickly, we realized that we needed to partner in this space. And so I set out on this long journey of talking to just about every single digital behavioral health company that I could. And from that, I started to realize I've had this sort of value-based rubric in mind, and Valera just checked every box. Yes, their digital infrastructure was just as user-friendly as the slickest option out there. But their commitment to quality was far and beyond what I saw in most every single company. It's if data is collected for behavioral health, it's PHQ-9s and GAD-7s, but Valera went yes and with the data they collect to show that they're a value and a clinically efficient and effective partner. The third area was on who they contract with. As MultiCare is a nonprofit healthcare system, and we serve all payers, all patients, all kinds, and that's important to us in our values. So to partner with a digital company that, say, would only take self-pay or only take self-pay in a handful of commercial products didn't reflect our values back. So to find Valera, who said yes, yes to commercial, yes to self-pay, but yes to Medicaid, yes to Medicare, yes to smaller regional plans, that really meant a lot to us and just how committed they were to reach as many people as they possibly could. And I think the people themselves are just incredible. I'm glad that Tom swiped right. It makes me very happy to this day. And I couldn't ask for a better partner, honestly. No. We've been so pleased since.
You're so kind, Sam. But literally, when I think I remember getting this email from this person, Samantha Clark, out of the blue. And I said, who is this person? And I started Googling, MultiCare health system, and I said, oh, they're legit. So I emailed back and we started a conversation, and it still wasn't apparent to me exactly what do they want us for. And because they're another provider, they have 2 psychiatric hospitals, and it's just weird conversation about partnership, and I didn't know exactly what that meant. So it's been really wonderful journey.
Right. And speaking of MultiCare being legit, Sam, am I correct? You've got primary care, specialty, emergency, urgent care across Washington State?
We do. MultiCare health system is growing. MultiCare behavioral health network within that is Washington State's largest behavioral health organization. So we have psychiatric hospitals, inpatient psych units, residential programs, outpatient services that span the lifespan, and a growing integrated presence within our different specialty clinics and primary care pediatrics within the healthcare system. And we still need partnership to serve all of the people in our community with all of the needs that they have.
Exactly. Thank you. So would love to know, what will your two organizations plan to accomplish together? And more specifically, it sounds like populations you'll serve is quite vast.
Yeah, I think that really the purpose is to open up access, and I think you are the last person that I need to talk to about in terms of access. And I think that this is the situation where really 1+1 = 5, not just 3. I think Sam's organization has the hospitals and the primary care networks and this great footprint across the Pacific Northwest. And we have the kind of like the digital services and tech-enabled services and a data-driven approach in terms of like population-based management. So I think this is really a combination of forces where I think the product is so much more than individual organizations alone. And I think we can open up access. We can take better care of patients. We can serve a broader crowd. We can be far more reaching, and we can think about novel delivery models, kind of like even a hybrid model of both brick and mortar plus digital situation. And I think this is like a really true, when we call the collaborative care model for mental health, originated from University of Washington, Seattle. And this is a different type of collaborative care.
Okay, definitely want to ask you a little bit more about that. But before I jump in there, it'd be great to hear from both of you. How has the pandemic impacted both of your organizations? But more importantly, as we're hopefully moving out of it, do you see any continuous impact or ways that you'll do things differently moving forward?
I would say, even though MultiCare as a healthcare system was very forward thinking in just how much it committed to behavioral health and intentionally grew that service line and saw its value, I think now after the pandemic, or at least at this time, we're starting to more fully appreciate just where behavioral health shows up. It's not in the historical, just the emergency department or maybe sometimes the hospital or in primary care. It's in urgent care, it's in specialty care, it's all over the place. And so we're hearing from all of our partners within our healthcare system that as behavioral health leaders, they need us to work with them. They need us to call to them, to their patients' need. And I'm appreciative of that moving forward, because it allows us to have eyes wide open when we start planning growth, when we start planning partnerships. It allows us to have a better idea of where access needs to improve. And I'd say on a side note, silver lining is that our health literacy behavioral health is improving. And so pre-pandemic, it was a little bit more unique for someone to have the right terminology, right? Therapist, psychiatrist, anxiety, depression, be able to describe the symptoms there and what that felt like. But I think as a society, the lid's been lifted on behavioral health need, and we're talking about it more. And so I hope that improves people's ability to receive care. It improves their engagement and their readiness, and reduces the stigma and the bias around receiving behavioral health in general.
I think, at least for us, we started our telemental health service model about 20 months ago in July 2020, and we started in New York, and then now we're in 7 states, including Washington. And I think what we've demonstrated time and time again is that our infrastructure and our model can take care of not just the worried well, the mild, the moderate, but 30% of our patients are actually patients with severe and persistent mental illness. And many of them have schizophrenia and bipolar disorder and really, really severe depression. And almost 30% of our patients are folks with Medicaid that no one else accepts. 51% of our patients come from BIPOC communities, and 25% of our patients are LGBTQ plus focus. In New York, 40% of our visits are in designated HPSA, what they call health provider shortage areas as defined by the federal government. And so what we found is that our model is really great for, number one, taking care of the sickest and really the entire journey of acuity in a one-stop shop. And we're really now adding this extra layer of the health system partner, because we kind of did this alone with the payer, with the health plan in New York. But now, imagine how much more we can do post-pandemic. And they say that trauma lags about a year, 12 months to 16 months after, the mental health effects lag about 15, 16 months after the trauma itself. And so we're going to see another 2 to 3 years of the effects of the pandemic. And this just, what's happened with Buffalo, with the mass shooting, and with the economy. I think, the world is just wreaking havoc to our personal mental state of being. And I think all of us feel it. And I think we're going to see in our kids, the adolescents, and we're going to see in young adults, and as well as the geriatrics. And I think really having this partnership is just fantastic in terms of having this extra layer and taking it to the next level.
Absolutely. There's definitely more need to be addressed, of course, without stating the obvious there. Tom, maybe it'd be worthwhile, just for those who are unfamiliar with Valera's model, would you be willing to walk through that a little bit from a patient-provider perspective?
Yeah. So everyone can make an appointment with our what we call health navigators. Instead of asking 15 questions, we actually speak to a human being on the phone, and we kind of assess your need. A lot of patients don't have that health literacy to really determine, do I need therapy or do I need psychiatry? In fact, we've had a couple of cases where they're speaking to a health navigator and they're in crisis. And we've had to, the unfortunate situation where we had to call 911 and really de-escalate that person. And those happen on some rare occasions, but that navigator will walk you through and really assess what is the right appropriate care for you. And within our network, and another big differentiator here is that within our network, 70% of our providers are full-time. And the majority of our providers are not contractors, because we want to maintain a certain level of stability and quality and standard. And then we usually book the appointments, and the appointments are really timely, and it's usually within 5 days to 21 days, depending whether it's a child psychiatrist or a psychiatrist or a nurse practitioner or a therapist. And then after that, there's really longevity and continuity. Data shows that at least 60% of our SMI patients have been with us for 20 months now. So it's really, really high rate of continuity. The other big difference is that what Sam had said, 99% of our patients use their insurance benefit. And of course, we accept Medicaid, Medicare, and commercial. And so really it's very easy access. And then the visits are being conducted through our app and our own proprietary technology, and we'll ask you questions in between visits and find out exactly how you're doing. And we have full-time case managers to actually manage high-risk individuals in between visits. So making sure that you don't fall through the cracks, and really kind of be in this very high-performing model where we focus on outcomes and measurement science and really understand where you are in your journey.
Thanks so much, Tom. That was really helpful, and also just astounding the impact you've already had. Sam, it would be great to hear from your perspective about some of the advantages that will be specifically impacting MultiCare as you move forward together.
Absolutely. I think Tom has hit so many of the high points of what Valera has to offer. I mean, we as MultiCare, I think we're pretty great at creating new service lines, but I don't know that in the we've taken just to create this partnership and to sort of weave our visions together, that we could have created anything near what Tom and team have put together in terms of quality and comprehensive care, and just the fabric and diversity of providers and therapists that they have on their team. It's so impressive. And so for us, the journey to bringing access to care through a technology, through a service like Valera, it would have been like a marathon to get to that point where we had something to deploy and to give them. It would have taken us a long time at a relatively slow pace. But by partnering with Valera, it's more like a relay. We're sprinting as fast as we can to get to as many people as we can. And in this digital space, we can pass the baton to Valera, who's off like a rocket. And so for us, it increases access to care. It expedites that access to care. And because they're a different organization, it's like this beautiful kaleidoscope of different values and different ideas. And so they also make us better and challenge us in what we think is the best care or the right type of care. And I love that. It's like having this super, super fabulous, smart best friend who's like, oh, did you know that we're doing this? Like, oh, it's amazing. And so we're motivated the more we learn about Valera just by being next to them. And so it's just this synergistic win-win for everybody in it.
Yeah, you are too kind. You are too kind.
Jazzed all over again.
That's really great to hear. And also,
when she says he challenges us to do better, it's like, she knows when my tone of voice changes in the meetings. And I said, Sam, did you get this done? Are you guys doing your part? So, no, really, but they've been extremely wonderful. Health systems are traditionalists and they're also enterprise. And I don't need to remind you how enterprise move. And so, they've been wonderful partners. Thank you.
That's really great. I'm so glad to hear that. Sam, I also noticed you had like 4 different amazing analogies. I'm so bad at cliches, but that was very impressive. I love the relay example. I'll be sure to use that when I have the opportunity. So we are, of course, at the Going Digital Behavioral Health Tech Conference. So technology is an important piece of a lot of what we talk about. I'd love to hear how MultiCare and Valera are leveraging technology specifically to allow for more seamless care, exchange of information, or any other ways that you're doing it.
I think one of the things that I think Sam and MultiCare are open about is actually using our app and using an app-based digital approach in measurement science and really measuring patients' depressions, patients' anxiety, patients' social determinants of health issues, being able to actually push content on an automatic basis and in a personalized, customized fashion, based on your diagnosis, and then really collecting that engagement piece and feeding it back into kind of like, how do we do better? And also using a data-driven approach and understanding risk. If your sleep pattern changes, if your distance you travel changes, and that, potentially sets off an alert, I think that helps with understanding where patients are in their journey of recovery. And then lastly is really just the fact that the two organizations can exchange data and really do this in a much faster real-time basis is just tremendous.
Yeah, the only thing I would add is part of the nuts and bolts of the partnership is EHR integration, which I think is very unique in the structural sense. I don't see many health systems and virtual providers going to that length. But what that does for us is it does give us a clear path for data integration, data sharing. But it also, for all of our providers who are referring these patients to them in our EHR, notes, intakes, et cetera, are going to look and feel as if it were a MultiCare behavioral health clinician providing that service. And so you get that closed loop, you get that feeling of real team-based care, real collaborative care, like Tom mentioned earlier. And I think that that from a customer perspective, whether that customer is the patient, whether that customer is our providers, our teams, our employees, that's really an important piece of it.
Thanks so much. And on a related note, I like to ask our speakers this question, this idea of tech versus touch. How do we know how much of each is enough when it comes to bringing about the most optimal mental health and well-being for individuals? Any thoughts on that?
I'm happy to go.
Go ahead, Sam.
I think that both are needed. That's the easy answer, and I think the correct one. And both are needed because it needs to be more about patient choice, about what's right for people. I think healthcare for a long time has been very prescriptive, where appropriate, and in ways that maybe are a little top down in deciding what services people get and how they're going to get them and where they're going to get them and for how long they're going to get them. But by partnering together, by asking ourselves how we can diversify services and access points and tools and platforms, we're providing more people choice and more people access in ways that maybe inhibited them from wanting to access care before. And so I think that the right answer is both. And I'm excited that we're working in parallel to grow our respective services.
Yeah. And I think is that, I think that's the nature of the partnership as well. It offers optionality to the patient and patient preference. And we're going to see the 20 to 40-year-olds who prefers an app-based or treatment model. And I think we're going to see potentially the 75-year-old, 85-year-old that wants an in-person model. So we'll see those patient preferences and we can offer them choice.
Thanks so much. And I've got so many more questions, but I know we're already running out of time. If I could ask you one more, what's next for your partnership?
You go first. You do it first, Sam.
All good things, all very exciting things that, like Tom said, couldn't come fast enough. So I mentioned EHR integration. So we've got that ahead of us in the now. That is something that we're actively working on. And then just growing the number of people that we're seeing. I think that's sort of the major beacon that we're all marching towards. But just beyond that, there is a lot around population health and value-based care that we can achieve together. And that can go as far as your imagination can take you, which is just this really beautiful opportunity. Tom, I don't know if you want to say that.
Yeah, I think, how do we take collaboration to the next level and not be constrained to the University of Washington model? That I think that model was created almost 20 years ago in a co-located therapist or care manager under a PCP model. Like, how do we create collaboration in the digital sense for the 21st century of the 22nd century? Like, what does this post-pandemic collaboration model look like, where we're thinking about holistically both primary care services and integrated mental health services in a new way, and using data that we've never had before in a population-based model?
Excellent. That sounds super exciting. And congratulations on all of this amazing work so far. Thank you both, Tom and Sam, for your time today. And folks in the audience, please go ahead and learn more about each of their respective organizations and their partnerships, Valera and MultiCare. Thank you both so much.
Thank you for having us here.